All right. I'm back here with Rachel. And we were recently at a conference together. It was a great time.
It was a good time. I haven't laughed that hard in a really long time.
I think we actually spent a lot of time laughing about Michael Stack. I think mostly.
Shout out Michael Stack.
Big shout out, Michael. You keep going to bed at 7 p.m. We got you, man. So much fun. How are things for you in California?
Things are great. The weather has been kind of wild all over the country, except for
Yeah.
here. It's been beautiful. So we got really lucky.
Yeah, it has been.
Yeah.
It's like super heat waves and things of that nature. And
Yep.
today for us, it's like it's probably in the 70s, not too bad, but it's going to be
Yeah.
close to 100 after that. So
Awesome.
back at
How's
it.
Colorado treating you?
I'm loving it. It's such a
Yeah,
nice place.
it is.
The people are super nice here, like
They are.
crazy nice. It's when you're somewhere and people actually like where they live,
Totally.
that's Colorado. People, welcome to Colorado. It's amazing. It's been cool.
There's some amazing stat about the percentage of people that are implants in Colorado. I can't remember exactly what it is, but so many people move there. It's why when you look at the CDC obesity statistics, Colorado is always the sort of like holdout for when things tick up a little bit. And it's
Yeah.
because really healthy people move to Colorado because they just
Well,
love it and want to be there.
yeah, it is. I mean, I've lived a lot of places, and most people don't actually go, "Oh, welcome to this place. You're gonna
Yeah.
really love it." It's like, "Oh, yeah, this part's not that great, and this part's bad." Not in Colorado. It's like a badge of honor to live here. Everybody's like, "Oh, you're here.
That's amazing.
Welcome here." It's amazing. So it's been
We
really
always
nice.
we always thought we were going to land in Colorado, and we thought we thought we were going to land there so much for years. We were like, we're going to look for the right time to move to Colorado. And we lived on the East Coast, and we had a boat. We had a sailboat, and we
Oh,
actually named it the Colorado because we were like we were like going to manifest that. We were going to get
yeah,
there, and then we ended up in California. So
yeah. Well, California's very beautiful. It's very
true,
beautiful, and
true.
man, it was nice meeting you in person. We
In
met in real
person.
life, IRL, people.
Yeah,
That's the thing. And I remember you saying you're shorter than people think. People see you and you're shorter than they think, right?
I am quite short. It's true.
It's all right. I'm quite short too. It's totally fine. So, but it's funny. We met on LinkedIn. Was it LinkedIn how we met?
I think so. Yeah. I
Yeah.
want to say it was through Amy Bantham,
Oh yeah,
probably
yeah,
way back in the day. I think you were on her podcast or she was on
yeah.
yours or something. And
Both. Yeah.
you did the series with Michael Stack about changing the fitness industry. And
Hmm.
then I can't remember who reached out first, but we were like, we need to know each other because this is.
Yeah. Yeah. Well, it's interesting. I think that's a conversation certainly worth having. And obviously, we've talked about it and we've presented on it at
Yeah.
ACSM. After that presentation, which was a lot about, getting out of silos and professionalizing the industry, did you get any feedback about it or anything
Oh, a
like that?
ton. Yeah. So many people. I mean, you'll remember, and you talked about this in your recap podcast, but there were so many people in that room. People are just starving for making something different happen in this space. And a bunch of people have reached out and they're just like, I'm not really sure what to do about it yet, but
Yeah.
I feel like you're that group, you all were heading in the right direction and we need to be having this conversation, just from the perspective of what does the profession look like? How do we train our professionals? How do we act with each other when we're on the floor together? Um, we're just in a really different time and fitness is changing, thank goodness. Evolution's always good, but we can't be entrenched in all of our old ways as the profession changes.
Yeah, I totally agree. And I think it's interesting when I was at IDEA in LA and we were
Oh
talking
yeah,
about a lot of
huge
this.
congrats by the way.
Thank you.
Trainer of the year.
Ooh, snazzy.
That's awesome.
It was crazy. It was actually like really crazy.
Yeah.
Like this is like a huge event. And the moment was very overwhelming. It was extremely overwhelming.
Yeah. Well, so
And
well deserved.
thank you. But what's weird is like I kind of do a lot of my work in the shadow. I just basically post on LinkedIn. I don't have other social media. So it's very weird to be recognized by a lot of people
Sure.
and walking around and like everyone knows who you are. It was very strange. Very
Well, I
strange.
mean, you're a pretty out there guy, like people know who you are, but you're like what I would call an extroverted introvert, right? Like
Yeah.
you're one of these people, like you're pretty quiet, you have like your thing, and you can get up in front of a room and just like wow everybody. But yeah.
Yeah, well, I
Well,
just
huge
don't have my
congrats.
life on social media. Like, I'm not
Totally.
out
Yeah.
there. Like, I have my professional stuff and podcasts, but like my personal life is
Hmm.
definitely nowhere near social
Yeah.
media
Yeah.
at all. So I don't think
Smart.
people like
Smart.
know me. Smart.
Yeah.
Yes. And the other thing is people kept coming up to me, I'm going to follow you on IG. I'm like, I don't have
Yeah.
it. I don't
Yeah.
know. And then some
I
lady
went
goes,
down that rabbit hole when you
did
and I
you?
first met. I was like, where is he on social media? And then you're like, I'm not. And I was like, oh, that's brilliant.
Why does everybody say that but doesn't do it?
I
Here's the
know. We're
thing
all
though.
sucked into it. Yeah.
Yeah, I tried several years ago, and I got on. And I said, I don't like this. I don't want my stuff out here on this thing.
Yeah.
And that was just me, But the look of disbelief among my colleagues was
Yeah.
incredible about it. But I think a lot of people, same thing. I was in some committee meetings, and this topic keeps coming up about how do we kind of create Voltron here? How do we join the forces without messing up people's money? Because it's always about money, I
Sure.
feel, for that. And what are some things maybe you have been thinking about since we've been talking that could help in this arena?
Yeah. It's such a good point. And I like the idea. I do want, making money, this is our profession for all of us, right? And so I don't want to suggest that people, just start doing all their work for free or like have to be
Yeah,
super altruistic about, we want to do well by doing good in this space, right? And so I do want to keep that front of mind. And that was what Michael was presenting on is how can we create new financial models that can be really helpful for the trainers and the professionals in this space, and then also use those models to help people reach their goals, whether it's a health goal or sort of an aspirational feeling or, happiness kind of goal. But that's the things that I just keep coming back to. And one of the interesting things that I've got both positive and negative feedback on is basically surrounding this idea of, you were all talking on this panel about selling joy and
yeah,
how, the fitness industry for so long has been about image, it's been about weight, it's been about, strength gains, and the joy factor has really kind of, it's always been kind of an undercurrent, but it's never been the selling point. And I did get both positive and negative feedback on that, specifically around the financial piece was, yeah, it's great if people want to come and be happy, but like, how do you monetize that? Like, how do
yeah,
you show people that they're happier or whatever? So that's been something that's been swirling around in my brain a lot is, you know, how do we pivot into, and you talk about this a lot, is into the sort of like internal framework
yeah,
of changing the system. So, you're always talking about supporting the client and the, for lack of a better term, like sort of becoming the psychologist in the
yeah,
room, where
yeah,
like you are, and anybody that's ever been a trainer knows that you sort of become a de facto therapist for
for
everybody that you work
sure.
with. And how do you teach those skills? And how do you make that a part of the client journey without it just sounding a little, I don't know, like frou-frou hippie, right? Like it's just like like, "Oh, we're gonna sell joy." And
Yeah,
the other people that pushed back on this pretty hard, which was interesting, and we were at the American College of Sports Medicine, so it's sort of clinical space,
yeah,
is they were like, "That doesn't really play in the hospitals or in the clinical space, as if you wanna be a clinical exercise physiologist or
yeah.
something like that. Like, we don't sell joy. Like, yeah, that's your problem,
That's kind of your
actually.
big
Yeah,
problem here.
totally.
Are you
So this
selling
is,
morbidity? I mean,
yeah, yeah, totally. So this is the swirl that's been in my brain
yeah,
since we left, is how do you productize, or should you productize?
yeah.
I mean, I think I made that word up, I'm not sure.
It's okay.
This joy factor, this, because we all get into it because we love it, right? Like, why do we all
Yeah.
become part of the exercise, physical activity spaces? Because we love to exercise or be
Hmm.
physically active. We feel that deep intrinsic piece. So you don't have to sell it to us. But I think what we're selling to other people is not that. It's weight loss. It's a
Yes.
package. It's a, you know, strength metric or outcome. And I would love to figure out how to get this across the system where exercise, physical activity is not necessarily health, a health metric, right? Like
Yeah.
you don't have to measure it with a health metric. But that's hard to sell. It's hard to sell.
I think it's hard to sell among our colleagues
Yeah.
completely. I mean, I think about like at ACSM, I was actually surprised how many people attended our presentation.
Mm-hmm.
Considering the crowd, I mean, there's nothing against a more academic environment. I mean, we both have our terminal degrees. I mean, we
Yep.
understand this and stuff, and it was a very well attended and crazy amount of questions after. We were there like an hour afterwards.
Yep.
And there's contrast when I was at IDEA and Dr. Kelly Walters had a great presentation about bias and training. She's in California, and it was like 8 people in there. And it had a
Ugh.
lot with like working with clients and how
Yeah.
you don't present, implicit versus explicit bias. And I could tell she was disappointed. Big shout out to
Yeah.
Kelly. I wanted to show up to support her because I was like, I come to these type of things. But it's like, we're having trouble selling this to actual people working the business
Sure.
for that. And so I think that's another issue is this kind of within industry problem we're having too.
What was being sold? Like what were the selling points at Idea? Like what are the things that people are like, oh, we're going
Well,
after?
I always look at ideas like this as like my buddy Michael Pierce. Pierce always says it's the starving artist of the industry. It's really for like the people who are like your everyday trainer, everyday group exercise instructor. It's definitely a non-academic
Yeah.
environment, which I like existing in all those environments.
Sure.
I enjoy that. But I feel like I'm not a spokesperson for IDEA just because I won this thing, but I would say being in the behind the scenes, they're really trying to unite the entire industry. So, for
That's
instance, I can
great.
say this: I know they're partnering with ACSM for the Personal Trainer Institute in February.
That's
That's
awesome.
big. That's
Huge.
huge, and I know they are working on doing that with most of the certifications out there. Now, whether
That's
they respond to this or not,
awesome.
it's a whole other thing.
Hey, Idea and ACSM, let's make this
I
work.
mean,
Yeah.
that means, and I felt ACSM trying, and now that I see that there's these bridges together, and I'm sure that's a lot of Amy and Francis Narek and all these
Sure.
people. You got to get the right players in the space,
Yep. Shout out to Francis. He's
right?
working his
People
butt off.
like Francis and Amy, they're the right players. Unfortunately, I don't know a lot of the other players. I would love to, and I think
Reach
if you're
out.
really committed to the
LinkedIn.
industry, you better be a part of this. I really feel that.
I totally agree. I mean, that's something, it's funny, just coming back to the social media piece for a second, it's something that I pretty much exclusively use my social media for is bridging these gaps. So I think
Yeah,
that's something that you and I are really sort of aligned on, and what drew us together early on is just, we have to connect the dots because the
yeah,
silos are killing our industry. It's like you can't just be academic or just be fitness, right? It's got to
yeah,
be both. And it's got to be both for the practitioners. I have this series of courses that I offer through my Strong Process site that's nutrition and supplementation, which is my background, that exercise professionals should know, not necessarily because the professionals are, you know, perpetuating some kind of like myths or whatever, but because we're never really taught this stuff back in the
yeah,
day, right? And so, I always say like academics suck at Instagram. And because of that, there's this disconnect between these worlds where the doctors and the physicians and the academics live in one side of the room and the fitness wellness folks live on the other side of the room. And we need each other. Like ACSM needs IDEA and IDEA
yes,
needs ACSM
yes,
because these worlds have to talk to each other. Otherwise, this is just my personal opinion. Otherwise, this is where we get a lot of really unintentional and I would say well-intentioned misinformation, right? So
yeah,
like a trainer reads something or experiences something and then they're posting all over their social media, oh, I did this cold plunge for this or that or whatever. I took the supplement, blah, blah, blah. And they're like, this worked for me and I believe it's going to work for other people. But without the academic side of the house being like, we're going to collaborate to make sure that good information is getting disseminated within our profession and then getting sort of disseminated to the client, we end up with all this mixed matched information. At the
Yeah.
end of the day, the client's the one that suffers because they're like, well, this person's saying this person's saying that. So if we don't connect these dots, I mean, people, it's not like the end of the world. Like, it's not, people are going to like start dropping
Yeah.
dead because they're taking a cold plunge, but like, well, I guess maybe if you stay in it too long, but, like, the client just gets confused and gets pissed off at everybody. And it's
Yeah.
like, that's not helpful. So yeah,
It's definitely
connecting the
not.
dots.
But think about it, and it's like we're just doing this to ourselves. So, for example, IDEA was the same exact weekend as the NSCA National NSCA
Oh
conference. That should
no,
never
should
happen.
never happen. No.
That's poor planning, a lack of connection between the
Oh, yikes.
organizations. That should never happen. I just
Yeah.
call them out. I really don't care. I
No,
have not, you know, and
yeah, that
that's
should not happen.
shouldn't happen, right?
Because while those groups might not be exclusively like they're not the same group, there's a lot of overlap.
Yeah.
And like the strength and conditioning space, so that I think you and I hop around kind of all these spaces. Is the strength and conditioning space? They're doing some super cool, unique stuff
Yeah.
too, and they have to be part of this conversation. I mean, we talked about it. So I'm a program director for. Seems we're calling people out. I'm a program director for an exercise science program. And like even coming down to the accreditation process, it's like ACSM has their own accreditation,
Yeah.
NSCA has their own accreditation. And I have to fill out all that damn paperwork and pay fees to every
Yeah.
organization. And my students are like, well, who does it matter? Like, who cares? And I'm like, well, if you want to go take the test, if you want to take the CSCS test or the ACSM EP test, yeah, I have to get our program credentialed.
Yeah.
Yeah, the connecting of the dots is just, I know people are working on it. We're just not there
For
yet. And we
sure.
got to get there. But yeah, that idea in NSCA overlap is not
It's
cool.
not okay. Like
No.
that shouldn't happen. I don't know if that's going to be the same next year, but I do know that like IDEA is really reaching out. They're independent now, so they kind of
Yeah,
exist outside of any other organization, and they could essentially be a uniter
totally
for all
agree.
of these. So there's no reason for IDEA is a huge show that all the certifications should be there
Yep,
and
totally agree.
giving people options to go around. The floor was gigantic, and they had uh, the DECA Spartan group was there, was massive. It was huge. The mega circuit stuff you see at URSA, all that stuff. They had the
Yeah,
same things. But these, we should be uniting, and the certifications especially. It's fine, have your own thing, but give people options. Walk around, they can see ACE, they can see ACSM, they can see the NSCA, the whole thing. And we should be inviting colleges
yeah.
to
Oh,
these things. Like
totally.
ACSM does a good job of. I saw some of that.
Yep.
IDEA needs to do more of that. We need to get more colleges involved.
And the
Eh,
students.
Students, a big
Yeah,
we need a big student contingent at
yep.
these
I
conferences, I think.
agree. I totally
Because you're in
agree.
that environment mainly. I'm just getting back into it. What do you see about that?
Yeah, I mean, I think the thing is, I'll tell you that it's kind of fun. I think most of my students, so I'm at Norwich University, most of my students get into the exercise science space because, like all of us that got into this field, they like to exercise, right? So that's
Yeah.
number one. But the second thing is, most of them, when they first come in, because they're 18 years old and they have no idea what they want to do with their life, most of them come in and they're like, I want to be a personal trainer.
Yeah.
And we've talked about this before. And like up until very recently, and I think you and I are starting to change the narrative on this, up until very recently, people would be like, you're going to get a degree to be a personal trainer.
Yeah.
Like, why would you do that? Just go be a personal trainer. It's kind of like a lesser certification, right?
Yeah.
And I call BS on that, right? Like, I think have a degree in exercise, go be a personal trainer. It's only going to make the field better and stronger. And once you get through those degree programs, if you're like, I want to go the clinical route, now you've got a foundation
Yeah.
to do that. I want to go and become a college strength and conditioning coach. Now you've got a thing to do, a certification or an education to do that. And if at the end of that 4 years, you're like, no, I just really want to go work with people. I want to be a personal trainer.
Yeah.
That should be a really cool professional opportunity and not seen as less than. And I think this is something else, when you said, like, what are the things that are coming up after our conversation? It's just starting to percolate in my mind now. But this is something that I think we also need to work on, is that this isn't a hierarchy, right?
Yeah.
So it's not like one certification is a better certification than another. There is a place for every single professional in this space, right? So like if you want to be a strength and conditioning coach at a university, you need a certain level of education and you need to have an understanding of how to work with that very specific population.
Yeah.
But personal trainers are saving the world right now, literally like one person at a time. And for them to not have the same, like you see, and I think I might have even presented a slide that looks something like this in our presentation, is you see the sort of like hierarchy of the
Yeah.
exercise professional, and CPT is down on the bottom. Like,
Yep.
what? That's crazy. Like that, the people that work in this space, I consider myself one of them. You are now the
Yeah.
number one trainer for my group for the year. Like you can have a PhD and be an amazing personal
Yeah.
trainer, and vice versa. You can, just be a super amazing enthusiast and be a personal trainer. And I just feel like we need to get out of this hierarchy mentality
Yeah.
in this space. It's like everybody. So I'm a spin instructor too, right? And so
Love it.
the phraseology that I like to use is there's a butt for every saddle, right? Like,
Yeah.
like sometimes you want to go and just take a good old fashioned. I don't know if this is the like Schwinn. It used to be Mad Dog back in the day, right?
Yeah.
And then sometimes you want to go to Soul Cycle, and like that's two totally different
Sure.
places, but like people are going to really resonate with one or the other. So I think how do we sell joy is number one. How do we make this a thing? How do we connect the dots, and how do we sort of start to eliminate this hierarchy so that we bring some professionalization to the entire field?
Most definitely. The personal trainer conversation is interesting because I had done like a solo cast about sometimes you have shame about being a personal trainer and man, that was a big one because a lot of people contacted me. It was like, I've been feeling this way. And I
Yeah.
think not only does maybe the outside or allied health professionals or consumers sometimes think this, but within our industry, it's like, oh, you're a trainer. You're like at the bottom. Like
Yeah.
you should be aspiring to be an exercise physiologist or doing research. And that was one of my most proud things about winning that award is like, I'm a full-time trainer and I have
Yeah.
my doctorate and I've run clubs before and stuff, but I choose to be a full-time trainer.
Yeah.
I enjoy it. I really do. It should never be the last option for you. And I think so many of our colleagues look at it as the last option. It's difficult to maintain doing, but it's just a different rung on a different thing we're doing. It doesn't like make it worse, but I think it's also because it's very easy to become a trainer
Yeah.
too.
That's
Uh,
true.
so that also doesn't lend a lot of credibility, but it's certainly a very worthwhile profession to be in. And see, after that, my new thing is, well, it's not new for a lot of people in our discussion, but there's the conversation. What's the minimum criteria for entry
Hmm.
into our? Like, I've been really thinking about that, and sometimes I think the 4-year degree or traditional route is, it's good. Listen, I have it, you have it, the whole thing, but it's becoming so cost prohibitive. How can
Oh
you
yeah.
ask someone to pay so much money for something that maybe the return is really they're not going to be able to pay off their student loans, different things like that. So I'm going back into teaching community colleges, and I think that
Nice.
may be a good minimum criteria for the personal training entry level because in most states, if you have residency, it's very cheap to do a community college or free in some states. And so then you take the cost aspect out of it, you buffer up these community college vocational programs, and that could be an interesting opportunity for a minimum entry standard that's formalized but not outrageously expensive. Yeah.
Yeah, I totally agree. And I think as we're thinking about, the sort of like minimum requirement for entry too is this field is constantly changing, and there's
Yeah.
always going to be new modalities and new training techniques, and we all have to keep up on all of those trends,
Yeah.
and as the research is changing. And this is sort of where I see, like, do you need a 4-year degree to be a personal trainer? As it currently stands,
Yeah.
no, but you're always going to be a lifelong learner in this
Yeah.
space, right? And like, did you learn how to like differentiate between eccentric and concentric
Yeah.
contractions in your
Right.
exercise physiology class and like, understand how lactate is formed? Sure. Yeah. But I'm not necessarily convinced that that's going to make you a better trainer
No.
if you're committed to being a lifelong learner in the
Yeah.
space. And again, this comes right back to the idea of idea needs ACSM and
Yeah.
ACSM needs idea because all of this information just constantly needs to be fed into this system so that we're all speaking the same language. We all understand where the trends are. And one thing that I'll say as a researcher is I pick up a ton of cool research ideas from what's going on in the field, right? So
Yeah.
people experimenting, getting excited about stuff. It works both ways. And so, yeah, the lifelong learner bit, and again, it just comes right back to this idea of connecting the dots is that you don't
Yeah.
need a 4-year degree to get into this space, but you do need to, stay up on the information and make sure that you have good sources. But yeah, I think about this a lot too, especially as an educator, is how do we lower the barrier to entry
Yeah.
into exercise, knowing how essential it is for health and longevity and happiness.
I think there's a lot of discussions on lowering barriers for a lot of things. And in a good way, it's kind of like even conference attendees. So like a lot of these conferences are way too expensive for your general exercise professional. Like they
Yeah.
just are. And I think then you're forcing people to go to certain conferences because, well, this is going to cost a lot of money, the airfare, the travel, and then the actual cost to just be an attendee.
Yep.
And I think we have to lower the entrance fees for this stuff.
Yeah, I totally agree.
Right? If you want to get like your everyday trainer, group exercise instructor, even whatever, exercise physiologist, whoever, you need to make it cheaper for
Yeah.
people to be there. I guess it's a money conversation. I know.
Yeah, we're back to it, back to the
It
money.
always comes back to the money.
No, I totally agree. I mean, think about how much I was blessed to be able to have support from my university to come out to ACSM.
Yeah.
But when I put all those receipts together and send it back, exactly to your point, airfare, food, hotel, the cost to entry, and the conference fees, it's not less than $1,500,
Right.
$2,000 every time you go to these conferences. And you got to save your pennies for something like that, especially if you're a trainer. I wanted to come back to this idea of CPTs being looked at as less than too. This
Yeah.
was a thought that was swirling when you were talking. I think it was you in a podcast long ago that said something like, I walk into a room and I tell the crowd like, oh, what do you do? And you're like, oh, I'm a personal trainer. And they're like, oh, great. Good for you. And like the person next to me comes in and they're like, oh, I'm a physical therapist. And they're like, oh, cool. Like what? Right? Like, oh, that's just so great.
Whoa.
And yeah, I mean, look, love to the physical therapist, but at the end of the
Sure.
day, they're just like, they're doing personal training and with a very specific focus, right? I mean, again, loved the physical therapist. I
Right.
realize
You
that you
know
have a
what it
doctoral
is.
degree,
Yeah.
but yeah, right? Like we're all working to exercise with people.
Yeah.
And like I will often, it's funny when my kids come in, my students come in and they come in with their parents, they'll be like, oh, I want to be a personal trainer. And you can just see the parents like, their like nostrils flare.
How
and
could you?
yeah. They're like, how are you ever going to make a living out of this? Right. And I'm like, hey man, like I've made a fair share of money, like
Yeah.
in the fitness industry. Like it's a good profession.
Yeah.
It's a good side hustle. Like it got me through grad school, like it's one thing that again, this idea of like the money and everything else,
Yeah.
like you can make good money
Of
in this
course.
space and help people with a certified personal trainer certification, right? Like it doesn't have to be that you become you have a terminal degree. And again,
Yeah.
that's not to say that you wouldn't want to. Like, sure, there's reasons why you would want to go do something like that. But this comes back to this idea of we got to flatten the hierarchy and be like,
Yes.
everybody has a place in this space. Because me as a researcher and a program director now, like I've got a couple clients here and there, and most of them are on the nutrition side of the house now, but I don't have time to do
Yeah.
this kind of thing. Or when we're at a physician's conference, like sports medicine conference, and we're telling all the doctors, you got to talk to your patients about exercise. They get 5 minutes,
Yeah.
right? They get 5 minutes to talk to their patients. Who are they sending them to? They need to send them to the personal trainers who
Yeah.
have dedicated their life to help people be active. And like that needs to be an eyeball to eyeball sense of respect, is that, I'm going to diagnose that this person needs exercise for whatever it is that they're going through. And I'm going to give them to you because you are the professional that's doing the work in the field. And that's something that I would love to see more of as well, is that we can respect where each of us are in this sort of big circle, this big family of exercise that we have.
Yeah. Yeah. That was interesting at ACSM, like in the question and answer session.
Yeah.
And there were several doctors who were like, because Micah was really passionate about the outcomes,
Yeah.
and I think a lot of doctors were like, whoa, let's talk about this outcome thing here. I mean, like, how do we do this? And here's the limitations we have with time. And it's kind of like a whack-a-mole thing, it feels like, in our business. It's like, oh, we have to deal with the healthcare system. We have to deal with this lack of regulation. And then somebody's like, Amy's hitting it here, or Graham's trying to do this here. Francis, it's just like, pop, let's do some legislation here. It's so daunting, all the things that have to be done. But I'm a firm believer that we just have to have we got to have the right people in place who are really dedicated to, and we do have that. Um, but it starts with, I think we got to have a lot of advocacy in what we're doing. And I feel that I see the advocacy coming. It's just like that wheel is slow, man. I mean,
So
it's so
slow.
slow.
So slow. Like it literally is taking an act of Congress.
Yeah.
Well, and to your point, again, I'm going to hammer this point home
Hammer
too.
it.
Is like, I just, I just like, this is why we need to flatten the hierarchy, right? Because you've got people working to change legislation. You've got people working in the healthcare space. You've got people working in fitness. You've got people working in wellness. And like, we all have our place, and we're all in the same bucket of people, right? Like we need to be working together and have a mutual respect for one another, because it is essential that we are all part of this
Yes.
moving of the system forward, because any one pocket is not able to do it alone.
Yeah. Totally agree. Like, we need to have like the CES of fitness, where like everyone goes to CES in Vegas in January. They just know that's where you find out all the new stuff and electronics, and they even have a space for like fitness, essentially, and the gadgets and stuff. Like, we need our own CES where like it's understood that we all come together and we have incredible presentations. We flatten the hierarchy by meeting each other, and you know, the researcher, the exercise physiologist meets with the everyday trainer, and group exercise, and come in, we realize how important we all are to the whole scope of things. That's what we need. We
Yeah,
need that.
totally. It's funny. I'm thinking about one of the comments that came up at the end of our panel. It was I want to say an exercise like a clinical exercise
Mm-hmm.
physiologist that was like kind of pissed off that the PTs are getting into the space of,
Yeah.
personal training or whatever. And he's like,
Right.
like, how do you compete with these guys? They've got these degrees and whatever. And I remember Michael Stack just being like, man, there are plenty of people out there that need to start exercising. Like, we are all going to be set for clients for a long time if
For
we can
sure.
just get out there and get our message across. Then we do not need to compete with each other, because we all have our own pockets of people that we are working with.
Ugh.
And like, it's a great example, right, of sort of, flattening the hierarchy. Is if I'm really injured post surgery, let's say, it is not wise for me to go and work with a personal trainer in
Right.
a gym. I want to work with a PT that has a knowledge of my specific injury and knows how to get me from my cast or my, brace or whatever it is to a place where I can function. And then I want to be handed off to a really good personal trainer that can sort of help sustain that level of
Right.
activity that is not going to be, a burden from insurance, or, I got to go to the hospital to go see my PT. Like, no, I want to go to the fun gym down around the
Yeah.
corner where it's like things are super social. I've got somebody that shows up and they're like super excited to see me every day, and it's a fun space. Like, there's a space for all of these things. again, back to this idea, ACSM needs idea
Mm-hmm.
needs ACSM. It's got to work. It's got to start working this way.
It has to start working, and it should be like we're picking each other off, and then it
Mm-hmm.
becomes this one big thing. I mean, you can have your own stuff. I get that. I'm more of an idea of like a one really gigantic conference that an
Mm-hmm.
organization puts on that is not a certification. That's like IDEA or URSA is probably those type of organizations. IDEA has
Yeah.
been around since the 80s, so they have a huge foothold in the industry. And then, you get all the certifications there, and then the certifications can have their state clinics, their regional events, but make the big thing the
Yeah.
industry uniting event. You can still make your money doing these other things,
Totally.
but make this the thing that everybody has to like. Everybody knows they're going to be there at this thing every July or whatever type of
Yeah.
thing. And then you
Totally.
could actually have a celebration of the industry instead of going, are you going to IDEA or NSCA? Are you going to the ACSM conference or are you going to club industry? Like, we shouldn't be
Mm-hmm.
doing that.
Yeah, I agree. And it is funny when you go to these different conferences, they don't overlap either. So I'm thinking about ACSM. I think they had one exercise session, and by that I mean like one that we could participate, like go
Yeah.
exercise. Like I think they had
Yeah.
a fun run, right? And it's like we're the American College of Sports Medicine, and there's not like should there not be like fitness classes being offered all day?
Sure.
Like
Yeah.
and then vice versa, you go to something like IDEA and it's like all
So
fitness
many fitness
and
classes.
and
Yeah.
then you're right. And then it's like no academics, no lectures of like, here's where the research is on this side, like on all of these things. Yeah, I love it. It's funny. So back in the day, but this is pre-COVID. My little company is called Strong Process. It's an education company. And we had a bunch of conferences. They were super cool in Boston. It was called the Strong Process Forum. And it was exactly what you're talking about. Never scaled. COVID happened and whatever.
Yeah.
But this is what we did. It was about 100 people. So we were capped. And everybody that was in the audience was either a trainer or a fitness client, right? So like they took fitness classes. They were did personal training, whatever. They were exercisers, enthusiasts. Or the third group of people that I invited was a ton of academics. And here's what we did. All of the panels, we had 3 panels during the day. The panels were move, eat, and rest. And so for panel 1, which was move, we had 3 academics and a fitness instructor was the moderator. And so it was like, oh, finally, the fitness people can ask the academics what is going on in their specific space. And the academics were like, wait, you're doing what in the fitness industry? Like,
Yeah.
that's interesting. Like, tell me more about that. It was like a conversation starter between these two worlds. Unfortunately, it fizzled off because of COVID, but I would love to bring something like that back. It was so well received. And then it was like a fitness class in the morning, a fitness class at lunch, and a fitness class in the evening, and a bunch of really good food. It was just super fun. And finally, it was like, oh, God, all these worlds are connecting. So we got to do it.
We got to connect these worlds. It's like, because some of the places have more sizzle and pop. Like, you go to ACSM, you don't really feel the sizzle and pop. You feel the academic nature.
Yep.
When you're at IDEA, you get around a lot of like the sizzle. Like, you're going to see all of your quote unquote fitness celebrities. You're going to get like all
Lots
the
of
people who
sizzle.
are like popular in the fitness space.
Yep.
If you go to club industry, you're basically just meeting a bunch of corporate people.
Mm-hmm.
And it's just, people who are like developers, investors, and stuff like that. And it just would be good if you could see all those people in one place and get a feel for that.
You're bringing up a group that we haven't talked about yet. The corporate side of the house and you have some experience with this as,
I do.
as somebody that's developed this kind of programming and these facilities, is that something that we don't train our fitness enthusiasts to do? And the corporate folks, I have found on the whole, I'm painting with a broad brush here, have no idea what it takes to fill a class, what it takes to be the best personal trainer on the floor. They have no clue. I remember working for this spin studio that has since gone out of business. They were a big, a national brand, and they were sold maybe 2 or 3 times when we were working for them. And they were sold every time to like a worst corporate VC type
Yeah.
of firm. And like every time it was just like, we're cutting pay. We're going to make sure that they're like, you got to fill your classes and whatever. And like, they never understood exactly the sizzle. Like they don't
The sizzle.
understand the sizzle. Right. And
Yep.
so like, that's a group that needs to be pulled into this whole conversation too, is like, if you want to, be a franchise owner, or you want to open a club, or you want to open a fitness studio, like the fitness folks need to understand what that is. And that's what Michael Stack was talking about a
Right.
lot.
Yes.
But the corporate side needs to understand how they fill their spaces too. And like, I feel like that's an appreciation that's not theirs. Like we're just talent, right? We're just like you show up in a cute sports bra and like bring your sizzle and like, they think that that's all it takes, and it's like, no, like this is a we think about and prep and work our asses off to like make our profession what it is. So yeah, that's a group that needs to be involved in this conversation too, is the corporate set. Totally.
Big time. That's a big club industry thing. I've been to it a few times, and it's like, man, it's the suits, it's like, see a bunch of guys in suits walking around the floor and looking around at the next big thing. But it, regardless of what you think about it, it's part of the industry.
Yep.
Or if you go to like which I've been to CMAA, I've been a few times to Club Managers Association. Like that's where you find developers, country club folks. You're making deals with people in that aspect, and that's a whole side of the industry that a lot of the fitness people never see.
Yep.
For that, it'd be good to see them. They have a huge thing, but I think that it all speaks to the fact it's one big giant pot, and it would just be nice to be able to be at a place and I could like pick and choose those areas that I like. Tracks, like, hey, I want to be more of an owner operator. So in this mega conference we have, I'm going to spend most of my time going to these presentations. Whereas a lot of it's just a free for all, honestly. It's just like, oh, maybe I go to this at 2. I go to this at 4. People are just wandering around like zombies and stuff.
Yeah, I totally agree. Yeah, that would be, I feel like we're coming up with a big idea. Who's listening out there that can help us do this?
There'll plenty of people listening. I will be tagging all of these organizations in this on LinkedIn because they're all on there and stuff. And like, hey, come on, man, let's stir the pot a little. Sometimes you got to stir the pot. You got to be willing to put some stuff out there, call some people out in a nice way.
Yep.
And say, hey, why aren't you here? Why aren't you doing that? And I think too many people are doing their own thing. So many people are like, I'm an URSA person. I only go to URSA. I'm an ACSM person. I only go to that. Forget that. You need, let's try to get it together. And then we're all just in the business and we all come to a nice big event. And another thing I wanted to say is I ask a lot of people, why do you come to conferences or why do you, come to these things? To meet other people in my profession.
Yep.
Like they never say the presentations ever, but there's like a jillion presentations. When it's like in America, if most of the public wants a certain thing and then the legislation does opposite, what kind of sense does that make?
Yep.
Like, isn't it about the people? And the people want to meet other people that do what they do mostly, not sit in a conference room and see presentations.
Yep.
Why are we doing that?
Wouldn't it be cool? Wouldn't it be cool if it could be all of the above, right?
Yeah.
Like I think it would be awesome to have like a super interactive, several day long situation. Maybe there's tracks like you said where it's like, if I want to start a gym, here's how I do it, or I want to become a better personal trainer, here's how I do it, or I want to get into the clinical or the academic space, here's how I do it, and like, but then. In moments during the day, you go to a fitness class and you go and you get like, I love that when you go to URSA or IDEA and they have like 400, and I'm biased, but like 400 spin bikes in a room and like everybody's in there and it's bonkers and it's like so fun. That's missing from all this academic side of the house. And the stuff that's missing from the bonker side of the house is like, hey, we've got some really, I'm on a cryotherapy cold plunge kick right now, but like, hey, we've got some really cool data about cryotherapy. Like, here's what you need to know to bring back to your clients. Like, when should you do it? When shouldn't you do it? This is what the data says, Like, how cool would that be? I mean, at ACSM, I went to, because I'm working for this company called Restore now, which is the they have like sort of franchises all over the place. It's cryotherapy and infrared
Yeah.
sauna, red light therapy. And I'm doing a bunch of research to understand their modalities. And I went to this session at ACSM on cryotherapy, and it was standing room
Wow.
only. We were packed in like sardines because people want to know this stuff. Like, what does
Yes.
the data say behind all these cuckoo trends? Like,
Yeah.
that should be an
For sure.
a track. Like, myth busting would be like an
Myth
awesome.
busting track. Oh,
Yeah.
I love that. A myth busting track. That's
We're like,
great.
we get to talk to each other. Like, this is what we're seeing in the fitness industry. These are what the trends are. Here's what the data shows. Like, I don't know. There's just such opportunity here to break through a lot of these things.
I love that myth busting track. That's like a really, Rachel said it here. I mean, great ideas are popping up all over the place. I also think we should have, and anybody listening to this, I'm happy to run this at any of these conferences, a speed networking event
Yes.
for professionals. Because, listen, I'm sure you listen to this and everyone's done this. When you go to a conference or you go to an event and you want to talk to other people doing what you do, but you're kind of worried about what to say and it's kind of weird, or they're talking to other people. You don't want to look like a fool. It's like, but what if there is a time, and I've done this before, you just sit a bunch of people at a big long table and then you just pull people, go move to the next chair, and like almost forced interaction, but you voluntarily show up for it.
Yep.
The whole thing. And you'll meet so many people. It's kind of a speed dating concept, but it's a volume game. Like if you want to meet a lot of people, you got to set something up where people will meet each other. That's not necessarily like a party, right?
Yeah.
Like a lot of these places throw parties in the evening, which I'm good. I like to
You
party.
love to party.
I like to party. I'm not downing parties. I think people should party more. I'm telling you.
I did not peg you for a party guy back in the day. And I'm like, I love to hang out with you
Yes.
at a party. It
Big
is a
party guy.
good
I'm the life
time.
of the party.
True story.
I all about it. I think partying's great for all aspects of your life. You should never quit partying. You should just do it smarter.
Do partying smarter.
Do partying smarter, but never, ever quit partying. Ever.
Yep, I agree.
You never stop partying. But there should be an element where it's not necessarily about that, but it's like, hey, we're just meeting people. It's a volume game for that.
Yeah.
I'm happy to put that on. I'd be all about that. And
You know what would be super cool now that we're percolating on this too? So speed dating where you can like one-on-one with people.
Yes.
Have you ever heard of Y Combinator?
No.
It's like this tech thing. I don't know exactly how it works, but briefly, I think you get these like super smart people in the room and they pitch their whatever, like it's mostly like tech stuff, ideas to all these VCs and sort of like angel investors and whatever. But you know what would be super cool if we did this and had this connecting of the dots is that basically you would have something like Y Combinator and you get people that come and pitch their new fitness ideas.
Yeah.
But they're like, hey, this is what I need. Like, these are the people that I need involved in this in order to make it work. I need an investor. I need a researcher so that I can refine my concept. I need a marketer. Here are all the people that I think are in the audience. Like, come find me. I'm at this booth over here so that we can blow this up. Wouldn't that be cool?
That'll be interesting too. Yeah.
Yeah.
Anything where people could just have access to each other.
Yep.
And I also think like this is a busting thing here. Like get everyone, get the big time people who, quote unquote fitness celebrities, get them in it too. Have them be there. No one's above anyone else. Sit down, have the conversations. Everyone should be accessible in doing that. It's because I think it's like you see certain people in a certain light and you go, oh, I could never talk to this person. They've done this. They've won this. We got to shed that too. And you get those people down as well and say, okay, hey, Billy Blanks, you're going to be sitting here too during this thing.
Billy Blanks.
I talked to Billy at the thing.
That's awesome.
Yeah. It was so funny because I had talked to him. I'm sorry, Billy, but I don't know if you're going to hear this, but I'm just going to say this. Billy, the year before I talked to him for 20 minutes at IDEA. And then before the ceremony this year, I talked to him, and I'm not sure he remembered who I was. I'm almost positive he did not know who I was.
He probably talks to a lot of people.
Yeah, of course he does. Why would he remember
Yeah.
me? But I don't know. If I talked to somebody for 20 minutes, I think I would probably remember who they were,
Yeah.
but whatever.
Well, he'll remember you now that you got this award.
Oh, he definitely knew who I was after I got the award. But I think, you're around in that circle. And Billy's an awesome guy. He's a great guy. He's done so much for the industry. And, he actually reached a lot of the people who don't exercise for many
Totally.
years, right? I mean, he did the
Totally.
thing
I
that
mean,
we haven't done.
yep. 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 I mean, he was a pioneer in the at-home space like that. I
Yeah,
mean, think about like everything is at home now. Everything is remote. He's
right.
been doing that for 30 years.
Yeah,
Like, yeah.
he
Mm-hmm.
actually did it. He got a
Yep.
lot of people who would never even think of doing that stuff
Yep.
to do it. At a
And to
studio.
call it exercise, like
Right.
the fun thing that was just like not what typically people thought of as exercise to actually
Yeah.
just be like, no, it's just movement. Movement is like what we
Just
need
get
to do.
going. Let's
Yep.
go, like so. But it's funny when you're in spaces with those folks, I always think to myself, like, these people also need to be down with the everyday trainers. They need to
Yeah.
be talking to everybody. We gotta, it's fun to have people winning stuff and they're this award winner and all that, but like be relatable, be down with everyone. Come to this networking bit. Come to my networking event next year. I'm gonna make this happen. I'm gonna talk
Yep.
to some people. We're gonna talk to everyone, get everyone together. We need to unite. We have to unite badly, and
Yep.
and that's what was the beautiful thing about all of us presenting at ACSM. I mean, we're all coming from kind of different angles, I
Totally.
mean, Mike's an owner operator, essentially.
Yep.
He's a big business guy. You're a researcher. You still do spending stuff. I personal train. Amy's involved in a lot of legislation. She does Group X and stuff. Like, we're coming from all these different areas. We came together. And then the best part is we had an amazing meal together.
Yeah.
We
Yeah, we
literally had
did.
an amazing
We had a
meal
good
together.
party.
We had a great, never stop partying. I'm telling you, it may be one of the most important things you do in your life.
Totally.
I can't stand when people tell me, "Oh, I used to have a good time." I'm like, "Why are you stopping?" I was like, I'm not saying
And
you have
that's
to
when the
get
good stuff
blasted. Like,
no, that's when the good stuff comes out about people too. Like we've got
oh,
some dirt on Michael's staff
we got a
now.
lot of dirt on you, Michael. We know all about Michael's dating life and everything. We're not going to say anything about it,
Not
but
gonna say anything.
it's so much fun though. It's like I liked Michael more after
Yep.
that. Right?
Totally.
I enjoyed
And
I
we liked him
remember.
before, but now we like him even more.
Right.
Yeah.
And I remember actually sitting next to you and I looked over at you and you were laughing as hard as any person could ever laugh in their
I
life.
had tears rolling down my face at one point. I was laughing so hard. And it like the hits never stopped.
It
Like
did
it was
stop.
just one hilarious story or like comeback after another. It was fantastic.
It was great. Yeah. And like
Yep.
Amy, I look over at her, she's laughing, we're
Oh,
drinking, we're
totally.
talking. And that's like, to me, the best part of being alive is that
Yep.
stuff right
Yep.
there. You should never
Totally
stop
agree.
that. That meeting that
Totally.
we had is what the business should be doing. That,
Yep.
stirring
I
that pot
agree.
like that.
And two, like when you think about that with exercise, like just to like bring it back home to where we first started about the selling of the joy, like that's the stuff that like gets people to go into the spaces that we are trying to curate for them, right?
Yes.
Like the fist pumping, the like seeing each other and like laughing our faces off when like somebody does something stupid in the gym
Yeah.
or like cheering for each other when somebody does something amazing, like it like the fitness industry, that's one of the reasons why I love it so much. It is a big party,
It's a
like
big
every
party.
day.
Yeah.
You show up, like you go to like one of Billy Blanks's classes, like you're
Sure.
not going to, like you're not going to be serious. You're going to like
No.
smile and laugh and sweat and like,
Yeah.
make a fool of yourself with his
Make a
like
fool. I have a PhD in that too.
and like that's the stuff, just to like put an exclamation point back on it. Like this is why our industry is so awesome. And if each of the silos don't understand
Yeah.
that, then like it's not gonna this big thing, like we're not gonna be moving forward together. We're all gonna stay like in our
Yeah.
own little spaces. Because like you think about, like the people that were coming back to me and they're like, oh, like how do you sell joy in a clinic? I'm like,
Yeah.
how do you not sell joy to a cancer
I
patient or to somebody
know.
that has type 2 diabetes or to somebody that has, a disease where exercise can really be helpful? Like if you're making it boring and
Yes.
academic and dry, no wonder why people aren't coming back.
Exactly. That's my whole
So
thing. Like when
yeah,
I
you
work
got to
with people,
party.
you
You
got
got
to
to party.
party. I believe a lot of my success as a trainer over 23 years, just because I look at training as, one part, obviously exercise progression and understanding biomechanics and all that. Fine. I accept it. It's great. I have all that education, but I'm mostly an entertainer.
Yep.
I'm like mostly, the cruise ship director with my clients. I'm basically wearing khaki shorts and a button-up shirt, and I'm running games. And I'm going around. Oh, next person. Oh, how's it going? How's your trip going? Oh, we
Yep.
got bingo at 2:30. Yes, like, like,
But that's the thing. And that's the part, like, again, this idea of connecting the dots is like the corporate guy needs to understand that that is
yes,
super important to creating community and for bringing people back. And like the parent that is worried that their kid isn't going to make money from an exercise
yeah,
degree or a personal trainer account needs to know that, like, that's a full-time gig. Like, that's a
yeah,
good job. And like, you can get a good job doing that kind of fun stuff for your
yeah.
whole life. Like, that's, I don't know.
Don't you
We
want
gotta
your child to be happy? Like, I
happy.
mean, why would you want them to make a lot of money and be miserable? It makes no
Yeah.
sense to me.
No sense.
Zero.
No sense.
It
Yep.
happens all the time, though.
I
All
know.
the time. And you're impressionable when you're like 18, 19,
Yeah.
20, and you like, your parents are your first contact of influence. They're the original influencers, your
Yep.
parents. And
True.
listen, if they're telling you, don't do that, you won't make enough money, it's like, man, I mean, I'm the one that has to have this lived experience the rest of this
Yeah.
life, not you. I think I should decide what I like
Yeah.
to do. Come on.
And I want to be a personal
Yeah, damn
trainer.
it, yes. And I want to
Yeah.
party. I want to have a good time. Like, I want to have a great time, man. I'm telling you, it's a whole part of the thing. Listen, Dr. Rachel Pojednic, you are amazing. I'm so glad we met each
Oh,
other
same.
a long time ago.
Likewise.
We got to do some. I know we're always percolating that. We have to do something together.
I think
Yeah,
we have a big conference idea that's brewing
yeah,
right
we got
now.
to do
Yeah.
something together. I
Yep.
always enjoy
I
work
agree.
with you. You're hilarious. You're lots of fun. It's fan. Thank you for coming on my podcast. I
Oh,
appreciate
it's
it.
my pleasure. Thank you so much. Anytime. Let's do this again.
I think so. And tell all the wonderful people, because now 10,000 downloads a month, people are listening to this. Okay. It's not, whatever. People are actually listening. I get told all the time.
Amazing.
Please tell all the people who are listening how they can connect with you.
Yeah. So I am at Rachele Pojednic. So RACHELE POJEDNIC I am on most of the channels. So you can find that's my website, as well as Instagram is probably where I am most active. And please reach out. I think you and I are super aligned that like we
Yeah.
have to start talking to each other. We have to start connecting the dots, sharing ideas. So I love when people reach out. Don't be a stranger. Let's party together.
Party forever.
Yep.
Thanks, Rachel. Appreciate it.